Dear audience, it's my honor to present to you my 3 months progress on my PhD thesis, titled Intra-mammary lymph node metastasis on breast cancer patients. So first and foremost, I would like to introduce myself as well. My name is Jávor. I'm a 5th year medical student and a 1st year MD PhD student as well. My supervisors are friends Bahidi and Mihai Uhei. My scientific methodology supervisor is Isabel. We've got a vision to establish an improved breast cancer survival, and our mission is to provide evidence on effect of intramammary lymph node metastasis. We've got currently 2 ongoing projects. The number 1 is a systematic review and meta-analysis. In these, we compare the intramammary with the axillary lymph node metastasis prognosis. In the second, we do it the same, but in a retrospective way. The first project started in October 2024, and the second one in November. Let's move on to the first project. So as I said, the title is comparing the prognosis of breast cancer patients with or without intramammary lymph node metastasis. As a background, I would say, and of course it's needless to say, that breast cancer is the most commonly diagnosed cancer worldwide. 1 in 8 million women will suffer from breast cancer in their entire lives. Approximately more than 2.3 million new cases and 670,000 deaths were diagnosed in 2020. And of course, everybody knows that metastasis is a leading cause of death. Moreover, lymphatic spread often first goes to regional nodes. It's a key prognostic factor in terms of survival. 2 major lymphatic nodes are worth mentioning. The number 1 is the intramammary lymph node, abbreviated as IMLN, and the second one is the axillary lymph node, abbreviated as AXLN. The number 1, the intramammary lymph node, is located in the tissue, in the armpit, and the number 1 is the axillary lymph node, is located in the axillary fat. It's a primary site for monitoring. So one of you could come up with the question, how is it monitored or how is it described? Well, between the axilla and between the edge of the breast, there are levels, and each levels contain the approximate number of lymph nodes. So they just divided this area between the axilla and between the breast levels, and it makes easier to monitoring the approximately level of metastasis and lymph nodes. I would continue with the background. Breast cancer is spread through the IMLN. There are 2 major ways whether axillary lymph node is positive or negative. And in this study, we would like to investigate the case when axillary lymph node is negative. And in this case, we have to investigate an alternative pathway for metastasis. And till now, limited research has been done on isolated ISM melanoma. Our aim is to examine the prognostic effect of intramammary lymph node metastasis in oncological outcomes. Our clinical question is, what is the influence of intramammary lymph node metastasis on prognosis in breast cancer patients with axillary lymph node metastasis? Here conducted with P, the patients, the population with breast cancer patients with axillary lymph node metastasis. Our exposure is IMLN metastasis. The comparator is no IMLN metastasis described, and we divided the outcomes into 2. The major outcomes are overall survival, progression-free survival, and disease-free survival, and our secondary outcomes are event-free survival, mean time survival, and time to progression. And our hypothesis is intramammary lymph node metastasis worsens prognosis in breast cancer patients with axillary lymph node metastasis, positive metastasis. And our clinical research, or the implication for this study, could be the diagnostic extending to IMLN and decreasing the mortality, hopefully in the future. Our preliminary research, we divided into 2 domains, and here are our 3 key articles. The preliminary researches, we conducted this search in 3 different databases. No previous systematic reviews or meta-analysis were found, and no prospective registration is found as well. Here are the key articles. all of the 3 key articles, it was quite difficult to find 3 articles with the same measurement, because some articles controlled 4-year survival, 3 years survival, 10 years survival, but hopefully could find 3 which report the same survival time. And here's our final search key. We divided into 2 domains, domain 1 and domain 2. The preliminary searches were conducted in 3 databases as well, and we've got 666 results in PubMed, in Embase 2013, and in Cochrane 154. The topic is feasible, and the Prosperity is under progress currently. Let's move on to our second project, which has a title, Investigating the Metastatic Potential of Intramammary Lymph Node nodes in the breast in the absence of axillary lymph node involvement. This is a retrospective study. Moreover, compared with the last topic, I would say it's worth mentioning that limited research exists on the effect of IMLN alone, and it could bring new insights into tumor progression, personalized strategy, and patient outcomes as well. The research question for this study would be, how does the clinical oncological survival change in case of intramammary lymph node metastasis? Here, or patients patients diagnosed with breast cancer, exposure is IMLN metastasis, comparator is no IMLN metastasis, and outcome is overall survival and disease-free about the same time. Our hypothesis for these is intramammary lymph node worsens prognosis in breast cancer patients. About the registry resources, about human resources, we do it. I do it with 2 senior investigators, Ferenc Báhindy and Mihály Uhay, with my 2 supervisors, and I'm the PhD student. And the data will be collected, and the patient's enrollment will be between 2008 and 2024. And 2 centers will be involved, the National Institute of Oncology and the Semmelweis University Dental Database. And the data collection will be listed in an Excel sheet. And to sum up what I said, comparing the prognosis and patient's cancer with or without lymphatic nodes metastasis, that was a systematic review and meta-analysis. Hopefully we got a planned submission date by the end of October 2025. And the second topic, which I talked about, is a retrospective study in the breast, examine the breast in the absence of axillary lymph node involvement. And this one has a planned submission time by December 2026. And as Albert Einstein once said, wisdom is not a product of schooling, but of the lifelong attempt to acquire it. And I would like to close my presentation with this quote. Thank you for your attention.
Thank you, Soma, this nice and interesting presentation. Is there any comments or questions?
Firstly, congratulations to your presentation. It was very interesting. I was wondering, you mentioned you want to extend the diagnostics for the intramammary metastasis. So I was wondering, do we not see it with the current routinely used diagnostic modalities, or we do not pay attention to it? What's the problem here?
Rather, we do not pay attention to it. I'm not a clinician right now, but as far as I know, they are there, but the standard, the guideline, is regarding only the axillary lymph nodes. So axillary lymph nodes, positive, negative, that's good or not good, but we do not continue our investigation in terms of intramammary lymph node things. So
it's very interesting. Yeah. Thank you.
How could we imagine? I don't know whether all in the audience or anybody got any thoughts about the procedure itself. You mean the second one is a retrospective study. It was the advanced cases. It was a mastectomy, and how can you reveal the intramammary lymph nodes? So if it's normally, it's routinely, it's not removed. As far as I'm concerned, I don't know.
Yeah, it's a retrospective study, so all the data will be collected with the help of the pathologist as well. So in the National Center of Oncology, more than 10,000 or 11,000 cases were operated in the last 20 years. So these data would be reused and implanted to this study.
My question was actually if you do not a mastectomy, just a lumpectomy, so just remove the tumor and do the axillary lymphadenectomy, how will you have any information about the intramammary lymph nodes? So if it's a mastectomy, probably it's removed with the procedure itself. But if it's not routinely done, I don't know. Is there any expert in the whole on the topic? I mean, a surgeon? No. Oh, there is. Yes, I'm sorry. Do you know what I mean, actually?
Yeah, I absolutely know what you are talking about. So altogether, my problem is, so if I check in our institute the pathologic results, I don't know, is there any intramammary? So if they want to find that, they will. But if not, they won't. So yes, you have a great database, so with close to 10,000 patients. But if they find it, and other thing is, so we don't really know where is it. So because if we remove the tumor, and if it's 2 centimeters next to that, the resection line, then we don't know which one is the intramammary lymph node. I absolutely agree with you.
Okay, probably we will have the answer.
My question is that, did you find any research or paper that suggests a change in the treatment if you find this kind of metastasis?
I could find many papers regarding your question. So the last one was 2008, and they described completely that these things must be changed in terms of intramammary lymph node metastasis diagnosis. So the guidelines should be extended, although no one came up with the idea how to do it, and that would be our aim to change it a bit. So.